Bela speaking, dermatologist and cosmetic doctor of the Hogarth Medispa at Chiswick, and the founder of the Melanoma Mobile Mo Clinic franchise. And you are watching now the second episode of the Clinic Drive video series, and I'm gonna talk now about the significance of the comparative analysis in the Mo check and skin cancer screening process. So comparative analysis is a very important differentiating factor among mole check or skin cancer screening methods, because many of the early stage melanomas and skin cancers are invisible to the naked eye, and without the comparative analysis of images it's just impossible to catch these early stage melanomas. For example, the early stage melanoma that you can see on the screen now was caught by the comparative analysis. So on the upper row you can see the close-up images of the mole. On the lower row you can see the high magnification, the so-called dermatoscopic images, where you can assess the structure, the fine structure of the moles. On the left hand side you can see the previous set of images, and on the right hand side you can see the recent images. So to the naked eye there was no difference, it is a tiny mole, but when we assessed the high magnification images below, that we saw a change in the fine structure of the mole, and because of this we recommended removal of this particular pigmented lesion, and the histology came back as early stage melanoma. So the screening and the comparative analysis of the images have saved the life of the patient. So based on the existence of comparative analysis in screening methods, I can set up 3 different groups of mole checks or skin cancer screening. So at the first group there is no comparative analysis at all. The screening doctor assesses the moles with his or her naked eye and makes the decision whether everything is alright with the mole or not. So every screening every year is a first screening. There is no comparison between the years. The second group of mole checks or skin cancer screening is when there is a comparative analysis, but again the screening doctor makes the decision which mole needs to be photographed and which mole needs to be assessed or can be assessed to previous or coming images. Obviously the mole that I just showed you before would have been missed by this method, because this mole was undetectable to the naked eye. And the third group or third technology that we use at Melanoma Mobile as well is the total body full mole mapping. When we don't select among moles, each and every mole is photographed, and each and every mole is assessed or compared to the previous images. At the time of the first examination there is a second opinion, so the second assessment by another doctor. So when we make this comparative analysis, first we compare the regional images, when we can see the bigger regions of the body and we are looking for new moles or changing moles visible to the naked eye. Then we assess the close-up images, and finally we assess the dermatoscopic high magnification images when we can assess the fine structure of the mole. So this is the method how we do the comparative analysis. And having pictures on everything is a great thing, because it creates an opportunity for quality control and regular training of the screening stuff that we think it's very important, and we do it regularly. Maybe one disadvantage of the comparative analysis, the total body full mole mapping one, is the big workload. There are patients with high number of moles, so there are high number of images, and it takes time to compare everything. So maybe this is one of the disadvantages. So I think I have told everything important about comparative analysis. If you have any questions, please drop me a line on info@drbela.clinic, or you can send a message through my Facebook site as well. If you have found this video interesting or important, please share it with others. Otherwise, thank you very much for your time. Thank you for watching me, and see you at the next episode. Cheers.